through that mode. There was a lot of themes that emerged as I was reviewing those. So thank you for helping us develop a meaningful town hall today. With that said, we are scheduled to meet for 1 hour today. So we have a lot of content to get through. We're going to really focus in on delivering all that content to you. However, we know that we may miss some things. So we do have the chat function enabled. Please go ahead and put any questions you might have in the chat, and we'll wait till the end. Once we get to the end, if we haven't answered those questions and time permitting, we will address them then. So I do want to remind you, though, that we would prefer that you do not enter any client-specific questions in the chat. We'll give you some tools on how to connect with somebody who might help you with a member-specific scenario. And also, we need to be aware of confidentiality and not be sharing confidential information in the chat here. So, all right, with that said, I'm going to introduce you to Tammy Arnold. Tammy is our provider liaison here at Rocky Mountain Human Services, and she is going to kick us off.
Tammy, you're on mute.
Yeah.
I'm so sorry, guys. That's not a very good way to start, but I'm happy to be here. I'm happy to see so many people in attendance. It's really great for us as the staff at RMHS to see so many people attend. It's kind of disappointing when people don't show up to listen to all the things we want to talk about. So this is great. Thank you for coming. I've been with RMHS about 4 years. I work in several different capacities. You've probably seen my name in different things associated with appeals or other things. I've actually worked in the Medicaid arena for about 18 years. And every day I think I'm learning something new. But one of the things I really love about RMHS, and I hope you'll hear this message today, is we really do care about our clients, and we really want to help resolve all of these issues that we're all encountering right now. So we have a really packed agenda for you today. I'm going to if we can go to the next slide, please, Victor. Thank you. I'm going to give just a quick overview. We expect this will take most of that hour. So again, as Victor said, please send messages in chat. We'll try to answer them. If you have client-specific information that you need, that's where you would reach out to me or other members of our team. We don't want to put that in the chat. There's a lot that has changed over the past few months, especially for RMHS when we did the transition from a traditional CCB and SEP organization to the CMA model. And that's been further compounded by outside influences such as the end of the public health emergency and changes to the care and case management system. So this week, RMHS is making some changes to our case model system, and we'll be talking a little bit about that for you, get you familiar with what's happening. We'll also talk about how that's going to impact our members. There are several options for reaching out to RMHS and communicating, so we're going to review those. I'll be one of your options, so if you don't catch anything else today, please write my email address down. I'll be happy to talk with you. There's a lot of questions about CSRs and PARs right now, so we're going to go through that and talk about our plans for upcoming CSRs and PARs. Excuse me. We also are going to talk about the processing. So we have a lot to talk about. Again, just a reminder, send your questions in the chat box. Reach out to me personally if it's about a particular client. I'm happy to help out. And I'm going to toss the baton to Amy Becerra, who's going to take on the next slide.
Actually, I think we're going to have Georgia.
Yep, it's me.
Change of plans.
That's okay. Hi, everyone. I am Georgia Edson. My pronouns are she, her, hers, and I am the Chief Program Officer here at RMHS. It is really nice to, at least virtually, see some familiar faces. Some of you I haven't seen in a long time, and thank you so much for coming today. This is, we have intended to put together a time to be able to meet with providers well before the transition on November 1st. And as you have experienced, things kind of got a little challenging right out of the gate. And so, this is some content that we wanted to talk about, just as we're kind of talking about what the differences are in the CMA versus the CCB and SEP separation and some of those kinds of things. But most of the information we're going to talk about today kind of got usurped with where we are in the moment and the information that we want to share with all of you, in the hopes that some of the concerns that you have, some of the struggles that you are experiencing, that we can tell you kind of what our plan is for things that are within our control, and kind of where we see some of the plans for the future, as well as just some questions that you had that were sort of procedural questions in working with maybe a new case management agency to some of you. But just a little stroll down memory lane from November. All of us are aware that we are in the midst of the case management redesign process, which combines the previous IDD waivers that were facilitated through the community center boards with the single entry point waivers that were facilitated through those single entry point agencies, counties, into what's now called the Case Management Agency, RMHS, which had been the both CCB and single entry point in the metro area, is now the Case Management Agency for what's called DSA, or Designated Service Area 6, which is Denver and Adams County. And at that same time, last summer, the state moved away from the benefits utilization system, affectionately known as the BUS, and implemented the care and case management system as a client management system. I can't imagine that there's any of you that aren't super aware that happened last summer, and some of the issues that happen when you implement a new data management system of any sort, especially one on the statewide level, some of the challenges that have occurred. At the same time, the public health emergency ended, the pandemic was officially over, and
Yeah, we gotta find the volume.
if we can make sure that everyone has, sorry, I got distracted, make sure everyone is muted, that would be super helpful, thank you. So at the same time, the public health emergency ended, which meant that all of the exceptions to the rules around Medicaid eligibility and some of those kinds of things were sunsetted, and members needed to go through the process to meet functional and financial eligibility in the ways that they had prior to the transition. And so all of these things have happened at the same time, which is a lot of change for a system that serves statewide tens of thousands of people. And you can see that a lot of the things that are popping up on the screen are things that impacted our ability to be able to support people really, really well. The care and case management system has been a challenge for us in terms of making sure that members are assigned to the right case management agency. And I think that is one of the things we'll talk about today as you are contacting RMHS, for example, to get information on PARs, and we're telling you that we're not the case management agency, but you think that we should be. In-person meetings have started as well. Just a lot of things happened all at the same time. This is not news to all of you. Next slide, please. And in order to do our best to really support you all and members and families through this process, RMHS really took a very intensive focus on rolling up sleeves and making sure that we were focusing on things that were super important, things that are super important to you as well. doing our best to make sure that we call it the member experience, but that we're providing good customer service. We have not been providing the customer service that we believe people deserve. We've been focusing on making sure that case managers have the tools that they need to be able to do their job, that we're meeting the expectations of healthcare policy and financing, that we are focusing on our operations that ensure that we are meeting our responsibilities, and that we are accountable to you and to our other partners. These have been things that have been high focuses for us, especially over the past 2 months. Next slide, please. So Melissa's going to talk a little bit about a change that we made and then an evaluation of that change moving forward.
Yes, hi everyone. My name is Melissa Emery. I'm the Associate Director of Case Management here at Rocky Mountain Human Services. Like Georgia said, it's so great to see some familiar faces and names in the chat and some new people as well. It's been a long time. But yes, so I think most of you are aware that November 1st, we implemented what we called our care team model, which is where we separated some of the case management functions between 2 teams, the planning or service planning team effectively, and then our primary case management for the other case management tasks. We did this for a lot of reasons. We wanted to create teams of experts. We wanted to make job functions doable for our case managers, provide good customer service to you and the people we all support together. We had a lot of good reasons behind this change. But with everything Georgia just talked about, and then this change on top of it, we quickly assessed that that model wasn't meeting our goals. And so as we speak, we are reintegrating all of our case management teams and going back to a, quote, traditional case management model. So everyone's going to have one primary case manager for their case management. That person will do all tasks, including the annual plans. And then we are still keeping our intake separate. That's a little bit different. But as far as anyone actively receiving Medicaid benefits, they will now have their one assigned primary case manager. And teams are working on reassigning, again, I said, as we speak. This week, we'll have everyone reassigned back to a primary case manager. Next slide.
Can I jump in, Melissa?
Of course.
So one of the things that we know is true, maybe not as much for some of you, but for some of the providers on the non-IDD waiver side, making sure that you are made aware of case manager changes. Typically for teams for the IDD waivers, those case management teams have ensured that all members of the interdisciplinary team are getting updates when a case manager has changed. We've not been as consistent about doing that across the board. And we know that has provided or caused some struggles and some concerns. And so we are looking at some ways to ensure that we are communicating with provider agencies so that they know when a case manager has changed. We regularly send out letters to the member themselves. And we want to make sure that other people who are connected to that person also know that the case manager has changed. So please know that is coming, and we will roll out our plan in the not too distant future. But in the interim, there's some ways that you can get that information relatively easily. But we want to make it easier. So if we could flip to the next slide.
Yeah, that's a good segue, Georgia. That was some of what we want to talk about here, because we know that reaching case managers has been a struggle, knowing who's assigned. So we do have our email and phone list on our website. I don't know if we're going to demonstrate that. I'm going to. Yeah, we're going to show you where it is on our website so you know where to go. But as they're pulling it up, I will say, we do our best to keep this list updated. And one of the things we're talking about is when a staff person leaves, putting on this list who to contact in their absence so that you would know who to reach out to. But if you have other suggestions too, as far as how we can communicate when staff leave and who to contact for different things, please feel free to throw it in the chat or email us. We welcome your ideas.
So this is the landing page on our website. And if you scroll down to the very bottom, you see that red case manager phone list. If Victor were to click on that, which he's not going to in the moment, it's going to pull up a Excel document that has the contact information of all of our case managers. It doesn't provide the members that they're associated with. It's just the contact information for those case managers. But as Melissa said, if you know that a case manager has left, we plan to add to that list the covering case manager so that you will know who to contact when someone is leaving. And I see in the chat, like we do our best to keep that list up to date. We work with our communication and outreach team who add all the new information to our website, and so we do a good job. If you are finding that there is kind of old information on there, please don't hesitate to reach out and let us know. All right, scrolling back to where we were. Thanks, Victor.
Yeah, thank you, Victor. I do want to add to, as we're reassigning caseloads with our reintegration of case management this week, we do intend to send letters for anyone who's getting a new case manager through that process, because it will be quite a handful of people. So those members will be receiving letters. If you support them directly, look out for those letters to have the new case manager's information. If you have a question about who the assigned case manager is, though, please feel free to email this email that's on the slide, cmaquestions@rmhumanservices.org. We have a great team of staff who man this email and can get back to you quickly on the assigned case manager and their contact information.
As a reminder, I probably don't need to do this for this group, but please send those emails secure, sending any name and Medicaid ID and those kinds of things that will be helpful for us to be able to give you that information. Just remember to send that secure.
Yes, please. Thank you, Georgia. And then as far as escalations, every staff person here should have on their email signature down toward the bottom who their supervisor is. That phone list we were just referencing has teams under supervisors as well. So you can readily access the supervisor's information, and feel free to email or call a case manager's supervisor if you're having trouble getting information back from a case manager. You can also email me or Georgia. I will fully put out the caveat today in this meeting that we're getting a lot of emails right now. I myself am quite behind. I hate it. I want to get back to you and be a resource for you all. I'm doing my best to get through them as fast as I can. But please feel free to email us and we will get back to you as quickly as we can. I think that's true of most of us here at this point. But we value being able to support you. And then if you have a complaint you would like to submit to Rocky Mountain Human Services, please use this email on here, clientassistance@rmhumanservices.org. And then we also linked the HCPF complaint page, and there's a form you can fill out to submit a complaint to HCPF as well. Excuse me.
I just wanted to add that we very intentionally put the supervisor's email on our signature lines. It was a recommendation from some community members, and it isn't intended to get people in trouble. It's intended to give you another resource for people to be able to answer your question. So we don't look at it as a negative. We look at it as a way to make sure that you have as many options as possible to be able to get your questions answered in a timely manner. And we recognize that in this moment, we are not responding as quickly as we want to. Some of the things that we're doing to be able to support that is, as Melissa talked about earlier, having our case managers go back to a traditional approach to case management. One of the main questions that we were receiving, both in our call center and in our questions, was who was going to be holding the annual meeting. And because our process was to have someone other than the primary case manager hold that meeting, and if the provider or the family didn't know who that was, they were calling a number of people. Now, because it's going to be the same person, we anticipate that will reduce some of the confusion and therefore some of the calls.
Tammy, you're muted again if you're talking.
I'm just having a heck of a time with my mute today. I apologize, everyone. Again, I'm here here's my address. You can always send things to me. Also, if you send a request to the CMA questions that they cannot answer for you, they aren't going to send it back to you. They're going to forward that to me so I can help work those. I have a large log list that I keep track of things. So if for some reason I'm out of the office, people can look on that list that work for RMHS and they can help answer your questions. We're trying to streamline how you can get your information. So again, we're going to work on the provider information, kind of bulking up that page and getting more information on it. If there's things that would be helpful with you, we'd love to hear from you. We can look at it and think we know what you need, but we aren't always as intuitive as to what you need as you are. So please feel free to make suggestions. This is a partnership we want to establish with all of you where we're working really hard to do what's best for our members. If you wouldn't mind going to the next slide, Victor. So I don't know how many of you know this, but just this last week, the HICPUF has changed us in the CMAs and the SEPs and the CCBs and the counties to streamlined eligibility. I'm sure as you all know, we used to have to send the DSS-1 form and the CERT form manually to the county, and they had to manually enter the information and send it back to us. Well, now that all is happening magically behind the scenes in the CCM system, and the way that it's working right now is that we enter the information when the CERT is, when their CSR is done, and the information is then updated overnight to the counties. They should be able to see it, and then theoretically, they can send that back to us with the confirmation the next day. So we should be able to turn around PARs a lot faster than we used to. One of the things that we're encountering right now with the end of the PHEs is that we're all dealing with financial eligibility breaks. Those weren't happening for about 4 years there. Now they're happening quite often. So those are some things. We have a team that's helping to work with the county, but if you're encountering one of those, that's another thing I'm working on are those. If you need some help to process a PAR and you haven't been able to get the answer that you need, please let me know. I'll investigate it. As I said, I've worked in Medicaid a long time, but just this week I found a new code that I'd never seen before that is a different way, a different challenge that we have to address in the system to get the PAR done. But if we know about it, that you don't have your PAR, we can work on getting it. Sometimes it means that we need to provide more documentation. Sometimes it's documentation at the county, but we need to look that up. And the only way that we're going to know that is if we can look up the individual clients. That's where you can reach out to me. One thing we cannot look up is that if we are no longer the case management agency assigned to your client, we can't look at those, but we can tell you who they are going to for case management. So that might help a little bit if you're not aware. So again, I think we said this, I think Georgia said this, but we are primarily serving Adams and Denver County now at Rocky Mountain. So CSRs, that's a big conversation. And I think Melissa touched on this, but we know we have some that are behind. And right now We are working with our staff to get any of those caught up. If there's one that you know of that you haven't heard on, please reach out to me. I'll be happy to look it up. My goal when you send emails to me is to always let you know I've got your email. I can't always answer your question right away. Sometimes I have to look for the answer, but I'll let you know I've got it and I'll get back to you as fast as I can. As we move forward, we're going to get everything caught up here in March. I think we've got some slides that say all hands on deck, which some people hate that seeing and some people love it, but just know everybody at RMHS is aware of it and we're all working in different capacities to try to get everything caught up. Our plan going ahead is that we'll be scheduling ahead. One of the things we've talked about, which I think is a great idea, is that we're going to schedule the next year's plan. I know we can't figure out where we're going to be next March, but I love when I go to my dentist or my doctor and they put me on the calendar and then I get that reminder. And if I can't make it that day, so if you can't make the CSR, if the client can't make the CSR, that's okay. We can reschedule it, but at least it doesn't fall off the calendar of everyone. And one of the things that's really important to remember when we do the CSRs is that we do need to have that member present. That's something that is required not only by the state, but also by the Centers for Medicaid and Medicare Services. So when we schedule those, we need to have the individuals there who know the client the best. Sorry, my voice is starting to go out on me a little bit here. I must have been talking too much today. So again, the best advice I can give right now is that if you're worried about something, please let me know and I'll be happy to help. If I can't answer you, I'll work on finding someone who can, but I will be in contact with you. So please feel free to contact me. Who's up next? I'm sorry, I've lost track.
I was just going to reiterate, if you don't mind, before Melissa talks about RFPs, is that we have dedicated the CMA questions at RM Human Services to be kind of your first line if you've got multiple people that you're looking for PARs, people that you don't know who the case manager is, you're looking for those kinds of things. So that would be your first line of defense. If you need to escalate or you've got something that's a little bit more complicated, please don't hesitate to reach out to Tammy. But the staff that support that general email box, they are looking up PARs and service plans and those kinds of things all day, every day. That's a big component of what they do. And they are returning those emails pretty quickly. If you give them a list, a pretty long list, it might take up to a week for them to get back to you. But if it's just a couple of people, they're getting back in just a couple of days. And so Victor just put that email in the chat again. Thank you.
Okay, we're going to switch gears just a little bit. I think this is going to be primarily for our program approved service agencies on the line, our PASAs, and maybe especially the PASAs who are newer to working with us with the transition in November. But we got some questions about our referral process or our RFP process, as it's often known. And if everyone could mute themselves. So the questions were around like, what does our process look like? So I'm going to outline it a little bit for you. The way that we do things is we have our case managers. This is primarily for people with IDD. They fill out a little Word document that we have. It's just a synopsis of the service that's needed, a little bit about the person who needs the service, their cross streets, so you get an idea of the area of town. We don't include any PHI in that initial referral form. And then we have an internal database where we keep all of our provider information. And our admin team pulls out all the providers that we have in the system who provide that particular service, and will email this referral out to all of you who provide the service. The response information is on that form of who you submit your response to as far as whether you can work with a person or not. And then our admin team gathers the responses. I think they give about a couple week turnaround time, and then give all the positive responses back to the case manager to work through with the member and their team. One thing we often run into that I want to put out here for you is If you're not getting referrals from us, but you know you're in our system, it's likely an email issue. If you changed the staff person who receives your referrals, or I mean, maybe we mistyped an email when we put it into the system, that's usually what we see when people aren't getting referrals. So just email us and we can check on that for you. Next slide, please, Victor. And I did just want to take a minute to let this group know, I'm sure you all know because it's been several years, but referrals actually aren't required of us any longer. Back in 2019, the regulations were updated because they were previously required in regs. But with the final settings rule and making things more member directed, in 2019, it was changed so that people can actually tell us how much support they want when they're looking for a new provider. We can go through that whole RFP process. We can send them just a big list. We can give them HCPF's webpage and they can look at information themselves. Or we can even narrow things down a little bit for them based on what we know of what they want in a service and give them several agency names and contact info to get them started making some calls. So just so you know, we do not send referrals for every single service that is needed for a person. It's based on what they want and what kind of support they want. And then I did see the question in the chat there about the correct, who do you email for correct emails and RFPs? You can do that CMA questions email on that one too. They can go into the system and check for you. Right, and then critical incident reporting. We do have a general critical incident email that you can send all your CSRs to. That is incidentreports@rmhumanservices.org here. And then wanted to do a quick reminder that any incidents of Maine, hospitalizations, and then unfortunately people passing away, those should be reported to us within 24 hours. So please do email those to us as quickly as possible. Thank you. And then the last one, this is sort of an upcoming issue we wanted to address here today. Back, I think it was end of January, we had a case management transition meeting with HCPF, where they forecasted for us some changes they're making to the rules and regs and waivers related to HRC. We're no longer going to be required to do HRC reviews for psychotropic medication use or for investigation reports. Now, I fully recognize that the regs are not updated at this time, and that you all are needing to follow regs and will be audited on things. So we've worked with HCPF, and their current guidance as far as all that goes is we should be prioritizing the reviews for the rights modifications and the other things that we would review in HRC, and sort of putting the psych meds and the investigations on the back burner for this month while they're working on updating the regs and the waivers. So at our agency, we've decided not to do any psych med reviews this month. If things start taking a little longer, or if HCPF changes their direction based on our feedback, then we can reinstate those psych med reviews when it's appropriate. Thank you very much.
Melissa, you got a couple of quick questions in the chat that I think are super fast and easy around RFP responses. Charlene asks if we are required to send those all responses to the member.
We send every positive response to the member and the person assisting them with finding that provider. So if you respond and say, yes, I can work with this person, you will be on that list and we will send it over to the member. They might not want to call every person on that list, but we do provide them every positive response.
And Nancy asks, emergency room visits were not previously documented as critical incidents. Has that changed?
Emergency room, that kind of depends based on the injury and things, but you're correct. Hospitalizations, unplanned hospitalizations are the critical incidents.
Yep. Okay. Okay, thank you. So we
think-
wanted to include these two links, both to CDPH&E, the Department of Public Health and Environment, as well as Healthcare Policy and Financing. We want to be really clear that we do not want our case managers answering your questions around business decisions or billing practices or those kinds of things that are specific to you running your business as an approved provider. And so just wanted to make sure that you have those links and know that our staff aren't trying to be difficult, but just want to make sure that you're getting the right information. We would hate for our case manager to inadvertently give you some incorrect information as it relates to running your business. So we got a few questions in RFPs around some regulatory requirements as it relates to providers, and just wanted you to go directly to the source. And then we can move on to the next slide. It's just kind of a little bit of a wrap up, and then we have some opportunity to get some questions. If you have some feedback around some things that may be helpful for providers, some things that you as providers would like to recommend that we do together, please don't hesitate to contact Tammy Arnold. We do want to have a variety of different kinds of provider communication. One of the things that we didn't do, but we have a link on our deck, we do have a provider page on our website. If you look at the tabs at the top of our page, the far right tab is a provider tab. Many of you have probably already clicked on that and know what that looks like and includes. We intend to continue to utilize that as a good way to communicate with you. We can do things like put this slide deck in that tab so that you have access to that, some of those kinds of things. But we want to be able to utilize the resources that we already have in place to be able to give you information, answer questions, those kinds of things. We also intend to have future town hall meetings. We're super open to feedback around content that you think would be helpful, cadence that you think would also be useful. Tammy is the right person to be able to send that information to. If it would be better to do some of these in person and what that might look like. If there's other kinds of ways that you want to be able to get information or interact with us, we want to do that as well. We want this to be a super collaborative relationship, especially right now when I think we can all agree that things are super challenging. And there's a lot of things that are difficult in the day-to-day, and we want to make sure that we are working together to be able to not contribute to making that more difficult, and working on ways for us to collaborate some solutions. So things to come. Before we address some questions in the chat, are there any content things we want to go back and look at? Okay.
We've got a few minutes, so we can work our way through the chat here and
Yeah,
make
that sounds
sure
great.
we've got questions answered. So I'll read those out, and then maybe one of you can jump in and provide some information.
Okay.
Charlene is asking if RMHS sends out the RFP, are they required to send each response from PASAs to the person requesting the services?
Yeah, we will, like I said, send every positive response to the person requesting the service. If you respond and say that you can't work with the person, we typically don't send those. But anyone who indicates they can will be on the list and be sent to the person and whoever is supporting them.
Latasha is wanting to get clarification around, are you saying that a member can reach out to an agency or PASA independently to choose and possibly receive services?
Yes, and that happens quite frequently in our system. Yes, a person can reach out to an agency, talk to you about the services they need, talk to you about what they want. If you're a good match, you can agree to work together. You do still need to let the case manager know so they can authorize those services before you begin them. But you can set it all up behind the scenes and then just let us know what you're going to do and get the services going.
All right. Nancy's asking, emergency room visits were not previously documented as critical incident reports. Has that changed?
No, it's the hospitalizations.
Yep.
Cassie's asking, where should we send main investigations now that HRC has stopped reviewing?
So you'll hear more as HCPF works through this, but they're actually setting it up so that our system does not complete these investigations. It's no longer required in our CMA contracts that case management agencies have someone LRA trained for investigations. Everything for a long time has been going through law enforcement and adult protection, and so they're taking us out of that loop. So I don't know that you'll even need to do them in the future. We will not be doing them in the future. You can keep sending them in if you want some eyes on them, but it's really law enforcement and APS that we're going to be leaning on for the investigations.
Great. Tasia, I'm going to just paraphrase your question. If a PASA has concerns that they are not on the RFP distribution list, who can they check with, and how can they validate that they are or are not on that distribution list?
Yeah, great question. You can use that CMA questions email, and we'll look into it for you and confirm.
Brooke is asking if you can just reiterate the HRC rules and when the HRC rules will take effect.
Mm-hmm. So they're currently being updated by HCPF. And they gave us the little preview on what they are updating, but they're working on that, and then they'll send out communication to our whole community when they're done.
It's anticipated that the new rules will go into effect March 16th.
Mm-hmm.
Damien, the deck will be available. If you go to the top of the chat, there's a link there that lets you know at the end of the week where you'll be able to find this slide deck. Sandra's asking, how can we have an email address deleted from your system when people move on from our agency?
Mm-hmm.
So you're getting emails about a specific person and you're not working with them any longer. We should be updating that pretty immediately in our internal database. If you're finding that, please email me and I can support our teams with making sure that gets updated.
Can I just clarify, are you talking about a staff person or a person that you were supporting?
Oh, good call. I was reading that as a person they're supporting.
Yeah, I'm Sandra, if you want to come off mute or just respond in the chat, whatever you feel most comfortable with. We want to make sure we're answering your question correctly.
So you're saying for the referrals, if your staff person leaves?
Can you all hear me?
Yep.
Yep.
The staff person.
Yes, it's a staff person that left our agency over a year ago, but we keep getting emails to that email address, which we no longer monitor. And then occasionally I'll go in there and look, and there are emails that we missed that went to that person that is no longer in that position.
Sure. We experience that as well. You can certainly send me that information and I'll make sure the teams get the records updated.
Okay, thank you so much.
Irina's asking what seems to be a simple question, but I think it's actually a very complicated one. Will PARs be backdated if you didn't complete the assessment in a timely manner? So I don't know if he wants to take that.
I mean that is a complicated question, and some of it depends upon where the member is in the public health emergency unwind, whether they've had their financial eligibility determined or not, will determine whether or not the date of that PAR can be backdated. So those are the kinds of questions that we should talk about individually. If you've got some specific people that you are concerned about, you can reach out to Melissa, to myself, to the case manager, and we can work through those.
Robert similarly has a question about PARs, may just fall into that answer. Georgia, how are we going to handle PAR revisions in a timely manner? It appears that often we are having PAR revisions needing to be made, and then we are notified of an eligibility break. This causes a delay, and we've been notified that the case manager cannot make a PAR revision if it is 30 days out from the PAR end date.
Well, the latter part of that, the 30 days out from the end date, isn't necessarily true. It really depends on when you requested the revision. So if all services should be prior authorized, and if you're asking for a revision and it's been 3 months and the PAR is over, we're going to have to talk about that because services should have been prior authorized before provided. If you ask and we have to wait through an eligibility issue and it's taken a little while, we'll certainly go in and update that PAR as soon as we can. There's no timelines for that unless you get into the year you have for the billing. But eligibility break should not dictate when we're doing that revision for you. We just have to get through the eligibility break.
All right, Kate is asking, I've been told by some case managers that RMHS does not send IDT notes out. Can you please clarify this, particularly as it pertains to right modification IDT notes?
Mm-hmm. Yeah, we take a bit of a different approach to IDTs, I think, here at RMHS. We have for a little while. We really view the IDT as the members of the team that the person wants there. So while we all might be working together to support a member, it's really up to them who they want at a team meeting. And we also don't necessarily view ourselves as just note takers. So for example, if you're a residential agency and you're having some issues with communication with a person, or you need to work through a little issue, we don't feel like we necessarily have to be at the meeting to work through that. You and the member and the host home provider, if that's who's involved, can work through that together. Just let us know the outcome. We can, document that in the system. We can update the PAR if necessary, if a service is changing, but we don't really feel like we have to be the ones there guiding that conversation and then sending out notes to the team just to document that it happened. Certain situations, yes, the 6-month review of rights mods, we will often hold IDTs for that. Those are quite important. Major issues going on with a person and we need to come together and figure out a plan to support them through a difficult situation. We'll come to the table for that for sure. But there are a lot of situations where historically you'd expect a case manager to be there and we don't necessarily feel we need to be.
All right. Prompted a few more questions, it looks like, Melissa. We'll work our way down. We'll
Sure.
work our way down.
I know. It often does. Yeah.
Eligibility and enrollment. Nancy wants to know where to refer prospective individuals and families.
We have a link on our website that is the fastest and easiest way to make a referral. We could probably get that into the chat for you all. We do also have email addresses and phone numbers you can call, but our website is the best bet.
Right. John's asking a question that we already addressed. The best way to get make sure that you are included in referrals.
Mm-hmm. Email that CMA questions email.
All right. New Day is asking, is the in-person model being implemented for all annual meetings? If so, why are letters regarding change in case manager not sent to the entire IDT versus just the individual receiving services?
I'd say that's a two-part answer. First of all, just logistically speaking, we can pull data out of our system with the member and their address and send the letter. Adding on provider agencies is pretty time intensive for us, and we want to get the information out as quickly as possible. Secondly, similar to the IDTs we were just talking about, the new regulations talk about support planning, service planning for people, and the people we need to invite to a meeting are dictated by the member themselves. So we're not going to necessarily blanket invite every person or provider on a team. We want to talk to the member first and make sure we're inviting the people they want at their annual meeting.
This may have been addressed, at least the second part. Is RMHS updating the HRC packet to reflect that psych meds are no longer being reviewed, or should PASAs now simply ignore that section from now on? Also, what's the effective date of the change?
Yeah, anticipated effective date is the 16th of this month, and then we are working on updating our different forms and things related to HRC right now.
Lynn's asking if people have been dropped as routine mailing, will they be backdated to the beginning of the month? Not sure.
Lynn, I
Not
wonder
sure.
if you can give a little bit more information about what that means.
Jason, hopefully we've repeated that email address enough times that you know to reach out to CM questions for your referral needs. Sandra says, during our survey, HICPUF specifically asked for IDT notes. They did say it could be a phone IDT, but they wanted to see notes. Probably a CDPHE survey, and I do think there's probably some of that happening, but Melissa, do you have advice there?
I do. I think what tends to happen with CDPHE when they come out and do their surveys is they interpret things slightly differently sometimes than HICPUF does in the case management side. So for those situations, please reach out to me and I can help navigate for you. It's usually the one surveyor who came out and did your survey, their interpretation of what they're looking at, and then it might be situation specific. So if you want to email me, I can dig into it for you.
Right.
And those IDT notes do not need to be written by the case manager.
Correct.
I think that's one of the things that is probably a little confusing for folks. There's nothing magic about the case manager being the one to write the notes. If you have a 6-month and you met as a team, you can write those notes. If there's a change in that rights modification, that's where we want to make sure that the case manager is involved.
Mm-hmm.
That segues perfectly into Jenny's question. Who determines if I'm assuming case manager, needs to be there? Often we'd like someone present for a major issue, but no one is available.
Yeah, there's a few factors there. If it's a major issue and needs immediate discussion or support, we don't want anything to be hung up on a case manager's schedule. So certainly the team could meet and then loop in the case manager after via email or phone call, just to touch base on a couple things. If you really feel a case manager needs to be there and you think they're refusing, for example, please reach out to their supervisor or me and we can discuss with them, what's going on. Sometimes it's a difference in interpretation. Sometimes it's scheduling. Sometimes we do need to talk to a case manager about their role in a team. So those are usually a little situational.
All right. Lynn gave us some clarification. Her original question said, if people have been dropped as routine mailing, will they be backdated to the beginning of the month? Meaning if they are sent letters stating services have ended and the next day a mailing approved and so on.
Sounds to me like maybe you're talking about mailings from the counties, like the Medicaid approval letters. Is that right? Yeah. Yeah, we've seen a lot of that too, Lynn, where someone will get an approval letter and the next day a denial or vice versa. And those letters are difficult for people to read through and understand half the time anyway. There have been a few factors that have gone into this. There were a big batch of letters that were sent to people incorrectly with 2/29 end date saying benefits were ending, and that was a complete mistake. And we needed to go back and address those.
To take care of everything.
Just gonna remind everyone to mute their mic. Thank you. Not you,
There's
Melissa, you
also-
can talk.
Oh, no, there's fine. I was actually muting that person. There's also some timing factors where if financial renewals are due and the member sends it in, but then the county doesn't look at it in time, they'll get a denial letter, but then the county looks at it and the approval's backdated, then they get that approval letter. In the meantime, like you're saying, we can't enter PARs if there's an eligibility break. So I think the best course of action for this is to reach out to the case manager. They can look at the benefits that are approved in the system. We can talk to the counties if we have questions to see what exactly is going on and try to help navigate through those situations, because the letters, I think we all know, can be a little misleading or confusing, or sometimes people don't even get them. There's a lot that goes on there.
All right. Thanks, Melissa. There is still some lingering questions about the 6 months, the IDT notes and so forth, but hopefully the message has been sent. If there is a actual need for that for as it relates to HRC or something along those lines, you know, we've got our escalation emails available to you. Melissa's made herself available if it needs that type of support. So hopefully you feel like you've got some resources now. And we are at the end of our time. Hopefully we have provided some helpful information to you. I will turn it to Georgia to kind of just close us out.
We super appreciate all of you and you being here. We know this is a super tough time, and you need information and you need it quickly. Please, again, don't hesitate. If you're not getting a response timely, ideally, we want to be responding within 2 business days. Don't hesitate to contact the supervisor, Tammy, Melissa, myself. We want to make ourselves available. And we will post this information on our website if you all have questions. After this meeting, again, reach out to Tammy and we will make sure that you get what you need. And we appreciate you. For those of you that may have seen that we are having another meeting on Thursday, the content is the same. You're more than welcome to join us again. But we had it a little bit split up between providers who support primarily people with intellectual and developmental disabilities, and then those other non-IDD waivers. But you're welcome to join us or not. It's up to you. But thank you so much for today, and have a great rest of your afternoon.
Thank you.
Thanks, everyone.